Thank you very much, everyone. So I'm going to be changing tack a little bit from what everyone else was discussing. But maybe before I start, just to say that neurocognitive functioning, or looking at someone's cognition, is quite a complicated assessment and really difficult to fully do in an assessment. And so I'm quite aware of that limitation in terms of what we're presenting, but I think it's important that, especially in children, that we think about their brain development and what that means for their future prognosis, even if we can't understand it completely with one assessment, but I think it is an important thing to be looking at. So I will be talking in terms of neurocognitive functioning in children who were on previous study SURE at school-going age. And I think the context behind this is that we know that the brain is a reservoir for HIV, and that in children specifically, it's developing and growing massively, especially the first 5 years of life. And the impact of HIV on the brain is obviously then important to consider. And the reason I'm doing this talk now, when everyone else has been talking about what drugs they should be using in children, is obviously because as we're moving towards HIV cure and strategies for this, and the talk of ART interruption as part of those strategies, that's what sort of got us thinking about this, and what we should be thinking in terms of the brain, which is what I'm interested in. So unfortunately, there has been little research into cognitive functioning after ART initiation and interruption and then restarting for various reasons. And so what we did was we remembered some previous research that we've done on where interruption was part of the study design, and so we decided to go back to that and have a look at it. So I'm sure everyone here is aware of the SURE study that was done many years ago to look at early implementation of ART in young children, and obviously was very successful and showed that we must be starting ART early, which is what we all know now. And from there, we decided to continue following up these children, and one of the sort of later studies that we did was the SURE Plus neuro study. So SURE ended in 2011, and from 2012 until 2015, we tried to call back some of these children to assess how they were doing various ways, but the one I'm going to be discussing is the neurological or neurophysiological study that we did. And so it was a cross-sectional study, which obviously has its limitations, but we did very extensive neuropsychological testing on these children, anywhere between the age of 6.5 and 8.5. And it was a more extensive study. I've listed here all the tests that we did do and what they were measuring, because I'm sure there are lots of people who don't know too much about these tests, but the important ones that I'm going to be discussing today are the top two, so the Kaufman Assessment Battery for Children, or KABC, and the Test of Variable Attention, the TOVA. And I will go a little bit more into them when I get to them. But as I said, the SURE Plus neuro study was a larger study, but what we've decided to use today for this purpose of this presentation was to evaluate the neuropsychological impact of ART interruption on children living with HIV of school-going age. And so that's what I will be discussing. So we pulled out the children that we wanted to look at from the study, and that was 269 participants. Just to say that they were mostly female, their median age was 7.3 years, and their median time at school was 25 months. So most of them been in school about a year or two when we did the study. From the SURE study, you'll remember that there were 3 arms. There was a deferred arm, so children who sort of followed the general guidelines at that point, which was that you only started when your CD4 count was less than 25%. There were children who we started as soon as we got an HIV diagnosis, and they went on till 1 year of age, and then the third group went on until 2 years of age. So now we've called them back to do the SURE Plus neuro study, and we kept them in those groups. So as you can see here, obviously median duration on ART would be a little bit longer in those who didn't interrupt, within the same sort of amount of time, so 6.7, 6.4, and 6.3, and then just an idea of how long they were off. I haven't included it here, but just to say that most of the children had started ART by about 6 months. The median age of starting was 20.9 weeks in the deferred arm, and then in the other two arms, obviously much earlier. Most of them started by 6 to 8 weeks of age. And very important, I think, just to state at the beginning, is that the main finding from the study and some of the other studies we've done subsequently is that there actually was very little difference if you looked at across all the tests at school-going age in terms of these three groups. They were all doing relatively the same, but sort of thinking about the fact that the brain is a developing organ and it continues developing quite significantly until teenage and even early adulthood, we decided to look at these results in a little bit more detail. And there were some notable results to consider. And that is that children who stopped ART sooner seemed to have a little bit worse neurocognitive impairment on one of the tests. So as I said, the one I'm looking at mostly is the KABC. It's a sort of general testing of cognitive performance in a few areas, and it consists of a whole lot of tests, and then what you can do is create something called the Mental Processing Index. But basically you put all of those together and you create a standard score, and the sort of guidelines is that if you score 69 or less, it's considered to be neurocognitive impairment. Obviously, this is one test out of a battery, and so, as I said, it's quite a complicated thing, and that doesn't mean these kids definitely have neurocognitive impairment, but we are saying that they're not doing as well as other children of their age. And so what you can see here quite significantly is that the children in the interrupted arms did worse, but those that interrupted earlier had 31% would be considered to have neurocognitive impairment on this test, and that's versus the deferred arm, and it had a p-value of 0.041. And we also did a multivariate regressional model on this, and again it came out as being significant to start having interrupted at an early age. But again, as I said, cognition is a complex thing, and one of the other things that did come out from our analysis of this is that the parents' educational level, so if the parents had a high educational level versus a lower educational level, that was also an important factor. So there are various things that we have to consider. So as it is research and nothing ever goes exactly according to plan, we also decided to look at this as a cohort, and so what we did was we took, obviously those children that were in the deferred arm were going to be on continuous medication because that's how the study was designed. But there were some children that were in the other two groups who were supposed to interrupt who didn't. And so what we decided to do was let's put them into the group of continuous. Yes, they started earlier, but they were on continuous ART. And so we derived these two cohorts, one that had interrupted and that one that was on continuous ART. And just important to note there again, because we're thinking about the brain and brain development, is the reasons for not interrupting was basically that these kids were quite sick. CD4 counts not coming up, severe CDC stage B disease or C disease, and there were a few other reasons as well, but those were most of the kids. And if you look at it in this way, same test, but different way of examining it, there actually isn't a significant difference between these two groups, which I suppose is something that we should be happy about, that, okay, maybe interrupting isn't that bad for the brain. What I would like to point out, though, is that we are saying that almost 1 in 3 children in this cohort would be considered to have a neurocognitive impairment, which is not great for the interrupted group, and 1 in 4 for the continuous group. So that part of it is not amazing, but you know, there is, at least it does seem in this cohort, that interruption isn't as bad as it looked in the previous one. But then, you know, when we were looking at all the data as well, there also then turned out to be this other sort of interesting part of it, and I think, again, speaking to the fact that our brains and our brain development are hugely, there are a huge amount of variables that can affect it. But there was this group within the interrupted cohort that had been interrupted on ART, and they never restarted before the end of the study because they never dropped their CD4 counts to the level that they were supposed to, or to the level that we wanted to restart their ART. And so we thought, well, let's also look at this group, and interestingly, they did the best in terms of the neurocognitive testing. And so they only had 13% on testing. Very small group, there were only 45 of these children. But I think it's important to sort of look at the multiple ways that, so starting early ART is important, but there's probably also some other sort of underlying factors, parents' education, I'm very sure genetics as well. But then again, something that was very interesting that we saw here is that their time of starting ART was actually the earliest out of all the groups. So the kids that didn't need to restart an ART, they had started at 6.7 weeks, whereas the actual median age was about 8.5, and if you look at the interrupted group, it was 8. So they were almost a week and a half earlier in terms of starting the ART, and maybe just even that week was an important for their brain development, and so something to think about. And then the last test that was that came out showing some interesting results was attentional ability. And so this is using a test called the TOVA. And again, if you there's a few subtests to it. If you put those together, you get the attentional performance index. And if you score less than 2, it indicates a possible attention deficit disorder. Obviously, ADD or ADHD is a clinical diagnosis. So we would just use this as part of that. But it's something interesting to look at. And here, those children that started later on their ART did worse, so the deferred arm. They had a median start at about 20.9 weeks, and they had the highest amount of attentional problems. And then when we broke it down again into the continuous versus interrupted group, you can see there that's much higher. And again, those that started the earliest had the least amount of attentional difficulties. So, in conclusion, early ART seems protective for long-term neurocognitive ability, and interruption of ART does not seem to have a big impact on later neurocognitive outcomes. But despite similar overall duration on ART in all these arms, early stopping at 1 year did seem to have a mild deleterious effect in some areas of later cognitive ability, and deferred initiation may affect your attentional ability. However, as I said, there are multiple factors and individual factors that play a role in your brain's neurocognitive development, as we can see with the subgroup within the interruption cohort. And thus, initiation of ART should be as soon as possible and continue during the early periods of brain growth to allow neurodevelopment without the risk from HIV. And so obviously, as we're moving forward to thinking about interruption, we need to then think about what this means in children, and consider all the areas that would be affected by interruption. Thank you.